Previous chiropractor didn't help. Well, does that mean chiropractic can't help? Here's 5 reasons patients fail chiropractic. Hey folks, I'm Dr. Jeff Williams and I'm the orthopedic specialist here at Creekstone Integrated Medical. I want to first encourage you to subscribe to our YouTube channel and like our Facebook page as well. It's important. This week, I want to talk to you about those patients that don't get better. I run into them fairly often actually, and it usually happens in a casual conversation out and about town with friends. When strangers find out that I'm a chiropractor, well, sometimes they tell me that they tried a chiropractor before, but it just didn't help them. They've never been back. Well, this never happens here inside my clinic, right? Mostly because these people no longer go to chiropractors. So used to go, but no longer goes, right? That's right. And this happens for a multitude of reasons. Some of the more common reasons this happens is, number 1, unrealistic expectations. Number 2, unwilling to do exercises or alter their behaviors. 3, financial issues. 4, they had a bad experience either directly or indirectly with chiropractors. And lastly, they gave it a good effort with the last chiropractor, but they never got out of pain, and they were left feeling like they just wasted their money. But before we dive into all of these reasons, let me be clear. Just because something like physical therapy doesn't help a patient, well, that doesn't mean that physical therapy can't help. Just because a chiropractor maybe didn't help before, that does not mean that chiropractic cannot help. Quite the contrary, actually. Every patient is different. Every chiropractor is different, and every injury is different. And sometimes what patients need is a different set of eyeballs, a different set of skills or tools in their toolbox that fit that patient's specific needs and issues just a little bit better than the previous provider. Sometimes it just comes down to pure experience and education. Some providers get out of school and they go to work, and they only do the minimal amount of learning and continuing education that is required of them each year to keep their license. Well, some continue achieving and learning throughout their entire career, obtaining high-level certifications, diplomats, and fellowships. And I can almost guarantee you that the high-level learners and achievers are going to be better. They're going to be better at being able to help with the difficult conditions where many other providers had difficulties getting results before. So this is just plain talk here. If you or a loved one, if you've been in significant pain and have been going to a chiropractor and just getting popped and sent right out the door with no other treatment options, you need to run. Don't walk out of there, and you need to find another provider. If you've been going to a chiropractor and or a physical therapist for months and you don't feel any better than when you started, you need to run. Don't walk out of there, and you need to find you another provider that can be effective for you. If you've been treating for 2 to 3 weeks with little to zero improvement, the provider either needs to change the treatment plan or you need to find a different provider. Plain and simple, you should be responding positively within 2 to 3 weeks. Now that plain talk is over, let's return to the 5 most common reasons chiropractic fails, and let's cover each one of them briefly for a deeper understanding. The first one was unrealistic expectations. Well, some patients have been hurting for a year or more. Some have been hurting 10 years or more. And they come into the clinic and are desperate for help, but they get irritated when the provider gives them recommendations for 2 to 3 times a week for up to 4 weeks to start assessing for effectiveness. They really, truly thought that they could just come in, the provider would say some magic words and pop all the bones in their body and hit the reset button, and they'd be good as new. Yeah. Sorry, folks. It doesn't happen that way. If we could do that, I'd be famous, I'd be super rich, I'd be on TV, and I'd be picking up patients in a Creekstone bus out at the airport because they'd be flying in from all over the world. We aren't magical like that. But with commitment, consistency, and buy-in on the patient's part, if they're a good teammate, you combine that with our education, experience, and integrated approach, after a week or 2, patients start noticing big changes and big differences typically. A new patient just this week shared with me that after just 3 visits, her back feels better now than it has felt in 10 years. Well, that's huge, especially for her. Chiropractic cannot heal long-term pain with a short-term answer. It's more complicated than that. Now the next reason, they're unwilling to do exercises and or alter their movement or behaviors. Again, patients just want to take a pill sometimes, take a shot, or go to a clinic and have a massage or a back adjusted and just be healed. Well, that'd be great for all involved, but it's usually not possible. Part of an evidence-based and highly effective treatment regimen must include exercises. You got to do that part. Movement, activity, and functionality. We got to do all of that if we're going to do any good at all. Not only that, but lots of times we have to coach patients on proper lifting, postural recommendations, and better, healthier ways of doing things. All of that is involved. This doesn't sit well with our more relaxed patients, if you know what I mean. They're simply unwilling to do these exercises and or unwilling to alter their behaviors or activities that got them into pain in the first place and kept them in pain for years. Now, how do you help the patients that refuse to be good teammates and help themselves? Well, it's difficult. Chiropractic did not fail these patients, they failed themselves. Now, the next one is financial issues. This is a pretty simple one. Healthcare is expensive and not all patients can afford what would be the very best for them. We understand that, and we are very sensitive to financial issues. We believe in telling our patients what research has suggested would be the best for their conditions, but then being very clear that we're here however they want to use us. The point cannot be avoided though. Some just cannot afford care and are hoping for a bit of a Hail Mary pass and hope that like one trip to the chiropractor will heal all of their ills. Easy for you to say. But here's the thing, chiropractic did not fail these patients either. They just couldn't follow through with the proper recommended care. Next, they had a bad experience either directly or indirectly with chiropractors. Well, one of the biggest reasons I hear that people refuse to go back to the chiropractor is because of bad experiences. Either directly from a chiropractor they were treating with or through indirect means such as a friend or a family member who experienced a bad appointment or bad treatment regimen with a bad chiropractor. And sometimes this means that the patient was scared into long-term treatment plans that they didn't really need. Sometimes it's that the chiropractor didn't make a good diagnosis. Well, it all starts with the diagnosis. And when the diagnosis is wrong, well, the following treatment is usually wrong as well and will not be as effective. Sometimes it's because the chiropractor they went to is just, well, weird. And the chiropractor claimed to be able to do a whole bunch of stuff that the actual evidence and research-based literature just can't support. And in cases like these, the institutions and the regulators of our profession, well, they may be to blame, right? They could do better at policing their providers. But the profession itself did not fail these patients either. The patients failed to do their due diligence in searching out the best providers in their community. And they failed to do their homework on the provider's education, experience, and reputation. A Facebook recommendation is never going to be as dependable as good old due diligence and background work. I can't tell you how many times I'm tagged in Facebook posts about finding a chiropractor and they get some of the worst recommendations. Don't do that. Do your homework. You'll almost always eventually be able to separate out the cream from the rest of the crop with a little bit of legwork. And then they gave it a good effort with the last chiropractor, but never got out of pain and was feeling like, they kind of wasted their money. And this can happen for several different reasons. One is that the chiropractor didn't get the diagnosis correct. As mentioned before, it all starts with the diagnosis. And if the provider gets that wrong, the treatment's wrong and probably not going to work. Another reason might be that the patient suffers from pain that has lasted for more than 3 months. After just 3 months of pain, well, now it's considered to be chronic pain. And at that point, it's harder to get rid of. At that point, a provider that specializes in orthopedics and knows about chronic pain can give lots of options to these patients. Options that might include medical care, right here in our clinic, spinal manipulative therapy here, cold laser, targeted exercises, massage, acupuncture, balance, movement, proprioceptive training, which is big in chronic pain. That can all be done right here at Creekstone Integrated Medical. In addition to these, a specialist would engage the patient in a conversation about cognitive behavioral therapy or mindfulness-based therapy, because chronic pain only goes away when there's a broad management protocol enacted to get these patients to finally, once and for all, respond. In chronic pain, chiropractic doesn't fail. Chronic pain pathways are permanent, and chiropractic is but a small part of the answer to start trying to slowly turn down the volume knob on these patients. Once again, let me be clear. If you or a loved one, if you've been going to a chiropractor and just getting popped and sent out of the office, back through the door with no other treatment or recommendations, you need to find a provider that has a fuller, bigger picture of what is going on, a bigger picture of your condition, and of what treatments research proves can successfully treat your condition. So, if you or a loved one is suffering, but is only seeking medication or treatment from pain management clinics, we may be a better fit and could have a better, safer, and non-invasive answers to your pain puzzle. Give us a try. What do you have to lose? Besides your pain, of course. Call us at 806-355-3000 so we can get you on our schedule just as soon as possible, usually within 48 hours. The right choice can literally change everything. If you're watching me on social media, share, subscribe, comment, and like, and all of the good stuff. Until next week, I'm Dr. Jeff Williams with Creekstone Integrated Medical. Be smart. We'll see you then.